We talked earlier in the show, actually, the lead into our second question of the day today concerns these new suggestions, recommendations that are all voluntary as to how we can make the situation in our long-term care homes in this country better, because God knows they need to be better. We all know just how ravaged these long-term care homes were during the first wave of the pandemic. Federal government said it was going to do something needed to be done. Well, now we have a set of guidelines that have come to the federal government. The question is, are they going to be implemented? Is just the fact that they have them and they're voluntary enough to really change anything? Dr. SAMIR Sinha is Director of Geriatrics at Sinai Health in Toronto. He's also chair of the technical committee that drafted these standards. He's on the line right now. Dr. Sinha, thanks for being here.
Thanks for having me.
I saw you last night talking about this, and, we asked people today. We had a very difficult time here in Quebec, as I'm sure the rest of the country did in our long-term care homes. And I look at some of the recommendations that are in here, and they seem like they make a tremendous amount of sense. But as I said, it seems to me the key word here is voluntary standards, and that is something a lot of people think, great, but will they get adopted, and what do you think?
Well, you're right. I mean, if standards like this, which basically are what 20,000 Canadians helped us to write as a committee, telling us that all these sorts of things are important to creating high-quality long-term care, such as having appropriate settings that are small in nature, allow people to have their own rooms for privacy and dignity, but also for better infection prevention and control, but making sure that we are supporting our staff to provide the care that they need to provide, adequately staffing homes, and then making sure that we focus our care on providing what we call resident-centered care that actually treats residents not like animals, but human beings, and making sure that we're thinking about and asking what do they need, how do they want their care to look like, and that we have clear guidance that really supports quality improvement and provides the leadership these homes need. So these are the standards we have. But as you said, they're practical. We made sure that these are accountable. You can be accountable to them, and that they're reasonable things that we can achieve. But again, if they're just voluntary, they're not going to have that much impact. The good news is places like Quebec have agreed that 100% of their long-term care homes are now going to be accredited against these new standards. But accreditation is only one thing. Accreditation is the home basically being able to prove to external examiners that they're actually adhering to these things and to these guidelines and recommendations. But Quebec also needs to make sure that its enforcement, its inspections programs are also linked to these standards, so that we can make sure that if there are concerns that are arising, that when inspectors or the government goes in, they're making sure that they can actually evaluate, is this home meeting these needs? If we don't do those sorts of things, and if Quebec doesn't fund its long-term care homes properly to provide at least 4 hours of care, we're going to be in a really difficult position to move long-term care forward.
It's nice to hear that Quebec is doing something right, or at least taking a step in the right direction, but it sounds like it just simply doesn't go far enough. And then by comparison, the other provinces aren't even close. Would you, in an ideal world, like to see these standards mandated across the country?
I would. The challenge that the federal government has is, well, they actually finance and support the Crown agency called the Standard Council of Canada that develops all the standards and oversees the development of all the standards we have. The tricky thing about long-term care is that it is a provincial and territorial jurisdiction. So we literally have 13 different versions of long-term care homes across the country, all sorts of different criteria that have arisen, different funding formulas, different mechanisms. So it's hard for the federal government to mandate something that ultimately it doesn't actually directly fund and oversee. This is why we have so many different outcomes that occurred during the pandemic, and why different provinces are taking different approaches. But what we have recommended, for example, is that we need to be providing at least 4 hours of direct care per day. And I was in Denmark last year with our Minister of Health in Quebec, taking him to some of the nursing homes there, some of the leading nursing homes, showing kind of what it actually looks like, and reminding him that, in that home that we were at, where there were 10 residents on a floor, there were 3 full-time staff present at that time, and asking him, how many staff do we actually have in a home? And when he says, well, okay, well, we have, one staff member for 8 residents. Well, you can't provide care that way. And the people in Denmark were just horrified when they heard that we might even staff a home that way. So the good news is that Ontario, Nova Scotia, Manitoba are all moving towards this 4-hour-a-day mark. I think there's a great opportunity now that Quebec is about to get a lot more money from Ottawa in exchange for accountability measures. Mm-hmm. They can put that money towards creating 4 hours of care, direct care per day per resident. And they can also use these standards for more than just accreditation, but also tying it to inspections enforcement, because everybody in Quebec, everybody across the country knows our homes didn't do well because we didn't set them up for success. And now we have clear regulations that Quebecers and experts from Quebec contributed towards, key recommendations that, frankly, we know what to do. We just have to do it.
Yeah, well, that's the problem. We talked about this earlier on, right? That whole idea of enforcement, that was the biggest hole in this entire situation, because it's all well and good, to have a list of requirements and guidelines and say we're the ones and we're going to enforce them. And if no one shows up to see that they're being followed, you're pretty much exactly where you started.
That's exactly it, right? And we saw, I think if we think back to the horrific stories that started to erupt, I remember just weeping when I saw what happened at Maison Héron, and just reading the accounts of the paramedics who said it was like they had entered into a concentration camp. The fact that we could actually even allow something like that to have happened in our own country, or when our military, went into homes in Quebec and Ontario and wrote reports that basically just told us that we were being our own worst enemies. You're absolutely right. We need proper enforcement. We need proper accountability. Those mechanisms do exist, but if they're toothless and they're not tied to these sorts of standards, then we're just going to keep repeating the same mistakes over and over and over. So, we were tasked, through this federal process to develop standards. We were tasked to talk to Canadians. 20,000 of them participated in this process. We actually released our draft standards almost a year ago so that people could review them. We had 3,600 comments. We've never had a standards process in Canadian history that had more public involvement than this one. So, if anybody says, did we miss anything? I'm like, well, when 20,000 people are looking over your shoulder, it's hard to miss anything.
That's great.
Yeah.
But so we have credible ones, but we need to actually enforce these. You're absolutely right.
Well, and
enforce.
All I think about, Doctor, in terms of enforcing is, we have such a lack of staff. Would it be easier to find staff to enforce these standards than it is to find staff to actually work in the long-term care homes?
It's one of those things where people say, well, should we staff the home properly, or should we just find more police officers to see what's going on?
Yeah.
I think people actually want to actually work in long-term care. But the problem is, in many parts of Canada, in publicly funded long-term care homes, you make a lower wage than if you were a nurse in a publicly funded hospital. Yeah. We shouldn't be treating long-term care settings as second-class places to work.
Agreed.
And we shouldn't treat nurses or frontline care assistants as second-class workers. They are first-class workers. They're doing some of the hardest work in healthcare. We should pay them fairly. And we talk a lot in these standards now about how we need to treat staff, how we need to give them whistleblower protections, how we need to encourage full-time work so they don't have to cobble multiple jobs in multiple homes, so homes can save money by giving them only part-time employment. By just treating staff like human beings, you create a healthy and competent workforce. You decrease turnover. You ultimately, as we like to say, the conditions of work are the conditions of care. So I think the key is that if we put money in so that we adequately staff homes, but then again, adhere to these standards about how to treat staff well in these environments. And there's a ton of science to support what we're talking about. You actually get, a really, really different kind of story. And I was really blessed, to be able to, take, the minister and his team, around, one of the best, well, not even the best, a typical nursing home in Denmark. And, his eyes were, quite open.
I bet.
He was like, this is different. And I want to point out key differences because, this is possible. This is not pie in the sky. These aren't lofty recommendations. These are things that we know are practical and doable if we just have the political will to make them happen.
Dr. Sinha, we're going to run out of time. We've got 30 seconds. Tell me where you are in the situation or the idea, because I asked this of our listeners as well, on eliminating private for-profit healthcare, long-term healthcare overall.
We, at the moment, I wouldn't say that we need a radical change in the system. I think we need to make sure that anybody who's participating in it needs to actually be following these standards. And that's the first step. And then after that, we know that private operators don't often deliver the same quality of care on average that public or not-for-profit operators do. But I leave that to the provinces and territories to figure out what they want to do. At first, let's actually just allow everybody to meet these basic standards and then figure out that other part next.
One thing at a time.
Dr. SAMIR Sinha, he is Director of Geriatrics at Sinai Health in Toronto, chair of the committee that drafted all these standards we've been talking about. Dr. Sinha, thank you so much for your time. Very much appreciate it.
Thanks for having me.